One of the most common missteps that you see when people are managing or getting treatment for OCD is the belief that in the moment anxiety is a reflection of progress or failure. So it's quite common that people will say, "Yeah, I had a really good week managing my OCD. I did a great job. I didn't feel any anxiety." They might also come in and say, "I did a really terrible job. I was so anxious all week." Neither of these things is actually an indication of whether someone's doing well or poorly in treatment. Effective treatment for OCD actually involves experiencing a lot of anxiety, a lot of distress, and then engaging in a response prevention plan. So being distressed and resisting urges to engage in compulsions. So it's really not an indication that you've done a bad job if you're feeling anxious. That's probably a sign that, hey, you're in the right position to learn something new. You're in the right position to benefit from treatment. You're feeling anxiety. Here's a chance to behave differently. Likewise, there is an ebb and flow to symptoms. Some days will be bad, some days will be good. And while it's really tempting to think, oh my God, I'm feeling so great today, I must be doing such an awesome job, it's not really an indication of how awesome job you're doing. There's ups and downs in life. You'll have good days and bad days. So that's kind of the bad news, is when you're feeling good, it's not really something to be proud of. But the good news is that when you're feeling bad, it's also not anything to be ashamed of. It's not a weakness that you feel anxiety today. It's probably an indication that you have an anxiety disorder that comes up and, gives you a hard time. So looking at whether you're anxious, whether you're not, that's not really an indication of progress. Progress is measured by, when I feel anxious, am I able to resist my compulsions? Am I able to stick to the plan I've come up with my therapist? That's a really good sign of progress. Even if you're feeling your absolute worst, but you're not compulsing, that's actually tremendous progress.